Record high cases, new restrictions, and lockdowns. COVID-19 infections are rising around the world, forcing countries to make tough decisions about New Year's celebrations. France is breaking records, reporting more than 208,000 new cases over the past 24 hours, the highest for a country in Europe. The French health minister says 2 people every second are testing positive for the virus. Greece is also seeing record new daily infections. New restrictions will begin there on Thursday. Bars, nightclubs, and restaurants will all be forced to close at midnight, except on New Year's, when they can stay open a little later. In addition, commercial venues hosting New Year's events will not be allowed to play music. The UK hit record-high daily infections this week. Scientists are criticizing Prime Minister Boris Johnson, who announced there will be no new restrictions in England before 2022, leaving bars and clubs open for all partygoers. Now, this is all on track with what we're seeing globally. The World Health Organization reports COVID-19 cases are up 11%. There were nearly 5 million newly reported cases from December 20th to the 26th. So for more on this, I want to bring in CBS News foreign correspondent Charlie D'Agata in London. Charlie, thanks so much for taking the time. Tell us about this new data from the World Health Organization. Almost 5 million cases in 1 week. That is certainly a significant number. What are some of the hardest hit countries, and what measures are they taking to try to mitigate some of this Omicron spread?
Yeah, well, Skylar, look at that setup to our discussion. It all looks pretty grim. And the World Health Organization, the statistics that we got, as you mentioned, it's an 11% increase. Now, it may not sound like much, but here's the real concern. It is starting to expand and accelerate exponentially. It's doubling every 2 to 3 days. Overwhelmingly, what we're seeing is the Omicron has taken over from Delta, the Delta spread. And the Omicron is spreading so quickly. And the 2 reasons that the World Health Organization say this is happening is it's both evading the immune system and an increased transmission. So when you put those both together, and the fact that it's able to apparently dodge some of the vaccines that are in place, that's the reason it's spreading so quickly. Where is it spreading? You mentioned it in part of that setup. You've got Greece, you've got France. Denmark is now a world leader, where they have one of the highest rates of transmission. The United States, as a matter of fact, and here in England and across Europe.
Interesting there. So we talked about France. It is certainly breaking records with daily COVID infections. We talked about this as well. The health minister is defending a plan to only allow vaccinated people access to certain places like restaurants and theaters. We've obviously seen that here domestically. Can you explain to us how that's going over, especially in France?
Yeah, well, France is in free fall. The health ministers today said it's not an Omicron wave, it is a tidal wave. So in addition to having those essentially what are COVID passports, which we have a similar thing here in the United Kingdom and in France, they've asked people to stay at home, work from home for 3 days a week. They've canceled large groups, so indoors you can have no more than 2,000 people in those large settings. They've canceled essentially all the New Year's Eve celebrations that would be taking place in Paris, in other cities where there'd normally traditionally be firework displays. All of those have been called off. But in terms of that COVID passport, yes, it is not without controversy. You need to either show that you've got 2 vaccines, that you double dosed, or have a booster, or that you've tested positive for COVID. Not everybody is happy about that, because it obviously discriminates if you've decided not to take the vaccine, or that you don't want to be forced into carrying paperwork in order to access some of these bars and clubs. So one way or another, they're either going to be shutting down the bars and clubs over the next few weeks. Certainly in January, I think we could probably expect something like that here, although it hasn't been announced yet. But they're not happy about it. It's worth mentioning, by the way, one of the things that is concerning the French and across Europe is France actually has a really high uptake in vaccines, close to 90%, and yet you're still seeing this huge spread, largely of the Omicron variant.
So then let's take a look at England. It's not restricting New Year's celebrations. However, Scotland, Wales, and Northern Ireland have all put limits on social gatherings. We know this is a big deal, especially as we get ready to ring in the new year. How's Prime Minister Boris Johnson defending this decision?
Well, Skylar, that's a tough one. I guess we're reminded every now and then here in the UK, it's made up of more than one country. You think of Britain or the United Kingdom as being one country, but you have got Scotland and Wales and Northern Ireland, and they all have different systems in place. Boris Johnson went against the grade, and he kind of went against some of his own health authorities in terms of deciding that there wasn't going to be a lockdown. He said there wouldn't be a lockdown. His health minister said that there wouldn't be a lockdown till the end of the year. So we're almost at the end of the year. So maybe they're just buying some time. But largely what he's saying is, yes, there is a high spread of this Omicron variant here in the United Kingdom, across Europe, in the United States, etc. However, it hasn't translated to a huge surge in hospitalizations or deaths. Now, the reason people are concerned about that and thinking this may be a risk too far is there's always traditionally a lag time between the number of positive cases and what that means in terms of hospitalizations and deaths. So yes, he is taking a risk, but it's a risk that he wants to take. Worth mentioning here as well that within his own government, in fact, within his own conservative government, there was a lot of backlash saying that they wouldn't allow this to take place anyway, simply because they believe that the science isn't here, that the Omicron variant is severe enough in terms of making people unwell or unwell enough to go to the hospital or to die. And going back to the World Health Organization, although we have seen 5 million new cases, I don't want to say this in terms of only, but in relative terms, there are 44,000 deaths. Now, if you compare that to what was happening in Delta or the first wave of the pandemic, it's just a fraction of what we're seeing in Omicron versus those previous waves.
Certainly a lot to take in there. Charlie D'Agata, we appreciate it. Thank you.
Thank you.